Hello, Rob. My name is Matthew Levin. I'm going to be the physical therapist that's going to be working with you today.
All right, cool.
So, what brings you into the clinic?
Well, I was in the hospital for about 2 weeks because I was diagnosed with pneumonia.
Okay.
So I was on some antibiotics, and I was just in my bed a lot. And I guess my nurses didn't switch me as much as they were supposed to, like change my position.
Okay.
And I got like a little pain on my heel, and come to find out that they diagnosed me with a pressure sore.
Okay.
So that's what I'm coming in to have you check out today.
Okay, great. And how old are you?
23.
And what are your usual activities? Activities consist of. So, uh, would you go to the gym? Walk?
Oh yeah, I go to the gym. I play basketball. I play some football, and just sports.
About how many times a week?
About 3 to 5 times a week.
What's your living environment?
I live in like in a two-story house. I live with my brother, and so yeah, that's it.
Have you been home since the hospital visit, or have you just come over?
I came straight here.
Okay. Do you live? So you said you live with your.
My brother.
With your brother?
Yes.
Okay. And overall, with your general health, how would you rate your general health before this visit to the hospital?
I would say it was pretty good. Pretty good. Pretty active.
On 0 being not healthy at all, to about 10.
0 to 10, I would say about 6.
6?
Yeah.
Do you smoke?
No.
And do you drink?
I do a little bit of drinking.
Okay. About how many times per week?
It would depend, but kind of like 3 to 5 times per week.
Okay.
Depending on the week, yeah.
All right. And are you on any medications since your recent hospital visit?
Just the antibiotics. I was on previously when I was diagnosed with the pneumonia, but right now I'm not on anything.
Okay. Are you allergic to anything such as latex, adhesives?
No,
anything
no,
like
I
that?
don't have any.
And are there any other past medical history that I should know about? Any surgeries? Any other wounds that?
No.
No. And like I said, when did you notice the wound?
I noticed the wound. Kind of. I felt kind of a little bit of a pain. At first, I didn't really notice the actual wound. The nurses and the staff they were the ones that noticed the wound when I started complaining about the pain.
Okay. And have any other tests been performed on it, or they just said it was a pressure sore?
For now, no tests really. They just wrapped it up, and for now, that's all they really did was wrap it up, just to make sure it doesn't get any worse.
Okay. And on a scale of 0 to 10, 0 being no pain at all, and 10 being the most excruciating pain you can have, how would you rate the pain due to the sore on your foot?
I would say about 6.
About 6?
Yeah.
And did you try to do anything to help with the wound? So did you try? What things helped you?
Well, I just try to stay off of it. Like if I was getting up to go to the restroom, I would just kind of hop on one leg, just kind of try to stay off of it as much as possible.
Did they give you any walking cane or assistive device like a crutch or anything?
Yeah, they gave me a crutch. They gave me some crutches so I can walk with them. Yeah.
Forearm crutch, okay. And do you say is it getting worse, staying the same? Or?
I think it's well, at first it was getting worse, but now that they've paying more attention to it, I think it's pretty much staying the same for the past couple of days.
Okay. All right. So now, during this portion of the assessment, I just collected some of your medical history. So during some of this portion of the assessment, I'm going to be looking at sort of observing some of your pressure ulcer. Excuse me. So I want you to lay on your stomach for me. I want you to head face over here. Identify. So as we can, I'm seeing right now on his left heel that we can see a nice red area on his left heel. I can see some, no sloughing at all, and I can see a nice blistering. And there's also a little cracking in there, and it's very superficial. And I can see it's definitely going through the epidermis and then through the dermis as well. So from my just first observation, I can see that it's a stage 2 ulcer, pressure ulcer, because there's no sloughing, and it's just going through the dermis. It's not going through any deeper than that. Okay, Rob. So I'm gonna just take the size and look at the size, how big your wound is. So I'm gonna say it's from head to tail. I'm gonna say it's 3 centimeters in length and 2.5 centimeters in width. And Rob, I'm gonna do a sensory assessment, okay?
Okay.
So I want you to close your eyes, and I'm gonna be doing different points on your body and on your foot, and I just want you to tell me if you can feel a sharp, or a dull sort of prick. So it's gonna be something like this, soft, and then it's gonna be something sharp like that, okay?
Okay.
And I'm starting right now. So close your eyes. Is that sharp or dull?
I don't feel anything.
Is that sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
I didn't really get a good.
Sharp or dull?
Sharp.
Sharp or dull?
I'm not sure.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Okay, so I went through the sensory assessment. Everything seemed to be intact. And now I'm going to do some of his pulses. So I'm going to do his tibialis posterior. And his dorsalis pedis. I'm going to do it on the other side as well. And that's also 2+, and I think it's a normal pulse. Also, I'm going to do the sensory assessment on the right leg as well. So again, it's going to be a prick or it's going to be a prick or a soft touch. Okay. So close your eyes one more time. Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
I didn't feel anything.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Okay. Also, all that seemed to be intact as well. And now I'm going to do assessment of your muscular strength and range of motion. So Rob, all I want you to do is flip over onto your back for me. And if you sit up with your hands on the bed. Great. I'm going to put a pillow underneath your left side here. My landmarks here. Can you bend your toes forward for me as much as possible? So bend your toes all the way to your head. Good. And relax. And then can you bend him all the way forward for me? Push, 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 push. And relax. So his dorsiflexion was 15 degrees, and his plantar flexion was 45 degrees. On the left side, I'm going to see the right side now. I'm going to lift this leg over. Now lift your leg lift your toes towards your body as far as you can go. And relax. Now move them forward as far as you can go. And relax. And bilaterally, his range of motion seemed to be symmetrical, so it did not seem to impede his range of motion. And now I'm going to test your muscular strength. I want you just to stand up for me. Great. And is that okay? Can you do that for me?
Yeah.
All right. And now I want you to go on your right foot first, and raise your leg up. And I want you to do one heel raise for me, and do as many as you can. And relax. Good. So you do pretty well on that one. And I'm going to do on the left side, so can you raise your right leg and go up for me? And relax. So on that, and you can go ahead and sit down on the bed. So on that one, I would say I would give him a 4+ on his right side and a 3, not a 4+, just a regular 4 and a 3 on his left side. The one repetition that he did on his left side seemed to be, the first one was fine, but the second one did not, which is okay, which is fine. Just does it hurt when you go up on your toes like that?
On the left, when it had a little just the going up kind of felt kind of weird, but the landing on my heel was the real pain.
Okay. All right, so one final assessment, if you can just lie on your back for me for a second. So on his left side, reading with my notes, the ulcer, it seems to be unblanchable erythema. That's the cause. And there's no hair really visible in the calcaneus. But it seems to be, like I said, a little crackled, a superficial ulcer. I would grade it as stage 2, and that's all. Thank you very much for your time today, Rob, and I hope we can help this and do some interventions that will help your heel.